Okay, I think we're going to go ahead and get started as people continue to filter in here. Hello and welcome to session 3 of the 8th annual Food is Medicine Symposium, hosted by the Center for Health Law and Policy Innovation of Harvard Law School and Community Servings. Today's session will focus on supporting innovation, the role of philanthropy in advancing food is medicine. My name is Katie Garfield, and I am a clinical instructor for the Center for Health Law and Policy Innovation. In just a moment, I'll be handing things over to David Waters, CEO of Community Servings, for opening remarks and an introduction to our panelists. Before I do, though, I'd like to just cover a couple of brief housekeeping items. First, as with our prior 2 webinars, we will be using the Q&A feature. So if you do have a question, either a logistical question that you'd like to ask the webinar hosts, or you have a question for our panelists, please do use the Q&A feature. Second, to answer a common question, we will be recording this session, and we will be making that recording available to all registrants after the event. That should be available in about a week, so likely early next week you will see that. And third, I'd like to note that because this is the 3rd session of our 3-part series, there are also recordings available of the earlier 2 sessions, which focused on food as medicine and the federal landscape, and then also taking a deep dive in our 2nd session here in Massachusetts to think about the Flexible Services Program. If you would like to access either of those recordings, you can go to our website at www.chilpi.org. We will also include them in the follow-up email to registrants after the webinar is complete. And then finally, I'd just like to note that if anyone is having technology issues today, you can reach out to my colleague, Kristen Sukis at ksukis@law.harvard.edu, and we will do our best to assist you. So with all of those housekeeping points in mind, I'd now like to turn things over to really kick things off with David Waters, CEO of Community Servings.
Thank you, Katie, and welcome everyone to the 3rd and final session of this year's Food is Medicine Symposium webinar series. Today's session will highlight the important role of philanthropy in supporting the food is medicine movement while the policy landscape shifts towards more sustainably funding for these services. As you heard in the first 2 webinars, there is currently limited government funding to reimburse for food as medicine interventions, but there is momentum at both the state and federal levels to expand these opportunities through legislation. Philanthropy is essential to support community-based organizations to expand their capacity and scale up in order to leverage these new opportunities for reimbursement through legislation. Leading today's discussion is my friend and colleague, Robert Greenwald. Robert is a clinical professor of law at Harvard Law School and the faculty director of the law school's Center for Health Law and Policy Innovation, or what we call CHILPI. In addition to teaching seminars in health and public health law and policy, for over 25 years, Robert has been engaged in state and national research, policy development, and advocacy to expand access to high-quality healthcare, reduce health disparities, and promote more equitable and effective healthcare systems. Robert is a longtime friend of Community Servings and food is medicine organizations across the country. He is co-author on the Massachusetts Food is Medicine State Plan and participates as a strategic partner to the National Food is Medicine Coalition. Robert will be moderating today's panel, highlighting funder-led initiatives in the food is medicine field. Each of the foundations we'll hear from today approach this space in a unique way, from focusing on specific populations, to funding research on an intervention type, to advancing food as medicine within the context of holistic, person-centered models of care. We'll hear first from Devon Klatell, Managing Director of the Rockefeller Foundation's Food Initiative. Devon joined the Rockefeller Foundation in 2013, where she currently leads the foundation's work to advance a more nourishing and sustainable food system in the United States. Prior to taking on this role, Devon led the process to refresh the foundation's global point of view on food and agriculture. She holds an MA in Food Systems from New York University, where she researched behavioral economics in addition to a broad array of cultural, historic, economic, and regulatory food issues. Following Devon, we'll hear from Phillip González, Senior Program Officer for the Tufts Health Plan Foundation. Phillip leads the foundation's community investment strategies to promote healthy living with an emphasis on older adults. Before joining the foundation, Phillip served as Program Director at Community Catalyst, a national nonprofit advocacy organization working to build consumer participation in the healthcare system. Phillip previously served as Director of Grant Making for the Blue Cross Blue Shield of Massachusetts Foundation, where he provided significant support for health policy advocacy and was directly involved in the implementation of Massachusetts' 2006 healthcare reform law. He holds a master's degree in public administration from the University of Massachusetts, Boston. Lastly, we'll hear from Michael Monopoli, Executive Director of Grants and Strategy for the DentaQuest Partnership for Oral Health Advancement. Dr. Monopoli leads grant-making activities and strategies to advance systems change by supporting a growing aligned national network to improve oral health and promote health equity. He's a graduate of the Tufts University School of Dental Medicine and received his Master of Public Health and Master of Science degrees from the Harvard University School of Public Health. Dr. Monopoli has served as the Dental Director of the Office of Oral Health for the Massachusetts Department of Public Health and is a past president of the American Association of Public Health Dentistry. We're looking forward to an engaging discussion with our accomplished moderator and panelists. And now I'll turn it over to you, Robert.
Good afternoon, everyone. Thank you, David, for your opening remarks. Welcome to part 3 of our 3-part Food is Medicine Symposium. Today, to provide some context for today's discussion, throughout this webinar series, we've been highlighting the latest research, policies, and innovations in the food is medicine field. Our symposium kicked off in November with a conversation on the future of food is medicine at the federal level, joined by Congressman Jim McGovern and the community servings client, Vanessa Georges. 2 weeks ago, our second session focused on food is medicine in Massachusetts, with a discussion on utilizing pathways in our Medicaid program to promote access to food and nutrition services, with Secretary Mary Lou Sudders of the Massachusetts Executive Office of Health and Human Services, Erin McAleer, President of Project Bread, and Kim Prendergast, the Director of Social Determinants of Health for Community Care Cooperative. Today, we are honored to be joined by 3 experts for a conversation on the role of philanthropy in driving food is medicine innovation. Now, all 3 of the sessions we have hosted this year touch upon food is medicine in the context of the difficult times we find ourselves in. While we have a vaccine in sight, we are still deep in the midst of the COVID pandemic, and we continue to see dramatic impact it is having on the need for basic services, including a broad range of food and nutrition services. Disappointingly, President Trump and our Congress have been unable to enact any significant COVID relief legislation since last April. And in part, as a result, the COVID crisis is placing an increasing strain on households across the nation. Feeding America estimates that roughly 1 in 6 adults and 1 in 4 children have experienced food insecurity in 2020. And here in Massachusetts, there has already been a 59% increase in food insecurity among adults and a 102% increase among children since the start of the pandemic. The COVID crisis has also shown a harsh light on the impact diet-related health conditions have on overall health outcomes, with individuals living with diet-related disease experiencing far greater risk of poor outcomes from COVID. And this has serious racial justice implications, with Blacks and Latinos being twice as likely to die from COVID than white people. Now, despite the many challenges we are facing, we are making progress in addressing the barriers and inequities both created and exacerbated by this pandemic. As we discussed in session 1, federal health systems, in particular Medicare and Medicaid, are allowing for increased flexibilities in providing access to food as medicine. In session 2, we talked about how both state government and community-based food and nutrition service providers are dramatically expanding the provision of food and nutrition services to those most in need. And most relevant to today's conversation, we will hear about how the philanthropic community is bringing its expertise, experience, and resources to efforts that support the development of more equitable and effective health and food systems throughout the COVID era and beyond. With these successes and challenges in mind, we're going to now have a series of short presentations from our panelists, with each panelist providing some background information on their respective foundations, their grant-making focus, and how food and nutrition services fit into their grant-making goals. We're going to start with Devon, then turn to Phillip, and then Michael.
Great. Thank you so much, Robert. And thank you to the team for putting this event together, and more importantly, to really being partners of the Rockefeller Foundation as we have entered this space in the US and really thought about how to invest from a philanthropic perspective into the food as medicine space. I thought, as you suggested, I'd share just a little bit about the Rockefeller Foundation for those who might not know. The Rockefeller Foundation was founded in 1913 with the mission to improve the well-being of humanity all around the world. We consider ourselves a science-driven philanthropy that advances new frontiers of data, policy, and innovation related to global challenges, including health, food, power, and equity and economic opportunity. And our foundation is global, and our food initiative within the foundation is global. And today I'm going to focus on our domestic portfolio. Next slide, please, Katie. So as I believe David mentioned in his introduction, a few years ago, Rockefeller undertook a process to really refresh our point of view on food and agriculture. And for much of the 20th century, we as a foundation made major investments in agriculture that were largely focused on agricultural productivity and the livelihoods of smallholder farmers. And that was because early in the 20th century, we believed that the greatest crisis of our time was to run out of calories, to not have enough calories to feed the world. As we entered this century, we really took a step back and, like many on this call, realized that the greatest crises of our food system were related to nutrition and to climate. And so several years ago, we refreshed our point of view to focus on building a food system that is nourishing and sustainable. And we try to take a whole systems approach to making that transformation. In particular, in recent years, we've focused on dietary quality as a key metric for our global portfolio and are working to catalyze an inclusive, sustainable future that substantially improves the dietary quality for tens of millions of vulnerable children and families around the world. Next slide, please, Katie. So within the United States portfolio, we have a few different ways that we're trying to catalyze food system transformation. We have some work on institutional procurement and the power of public spending to shift food systems. We have some work on policy advocacy. And then we have this really robust food as medicine portfolio, which is where I'm going to focus today. And I don't think I need to tell this audience the sort of magnitude of the health costs that we're paying collectively when it comes to poor diet, but certainly in our own thinking when we went through our strategic refresh, the fact that diet is now the leading cause of death and disability all around the world was a major factor in us deciding to focus on dietary quality. And also our sense and what we heard from others that the healthcare system in this country really only marginally addresses the role of food in the training of medical providers, in the provision of healthcare, in considering sort of healthcare costs. And we were just starting to see the dawning of a real interest in social determinants of health and in food in particular. And then, of course, there's the economic costs associated with healthcare in this country. And a statistic we often talk about is that the cost of diabetes alone is over $300 billion. So as we went into this space, we were looking to find solutions that could have a meaningful, measurable impact on health outcomes that could reach the most marginalized populations, populations that had a particularly hard time accessing healthy food and improving diet quality and suffered negative health outcomes as a result of that. And then also quite explicitly, one of our goals was to sort of recruit the health and healthcare sector as a better ally in food system transformation, to really try to partner with the health sector as a collaborator in investing in a better food system. And we believe that that would have positive outcomes for all Americans, and also that the health sector, along with other sectors like education and of course food and beverage, would be motivated to do that. So as we thought about our approach at Rockefeller, we consulted with lots of experts in the healthcare space, in the community-based organization leaders, researchers, and others, and we sort of identified these three, what we call pillars of our strategy that we try to support. The first is around generating better evidence on what works and solutions in the space. And we at Rockefeller decided to focus on produce prescriptions in particular as a program that showed a lot of promise and a lot of potential for impact, and that could benefit from some support in getting to scale. So we have partnered with several universities and also with Kaiser Permanente as a both technical advisor and co-funder to support new research looking at some of the evidence coming out of produce prescription programs and pilots all around the country. And I would just say this is the need that I think we hear most often when we go talk to private sector leaders and policymakers, just the need to continue to build the evidence base around specific food as medicine programs. So we're supporting some research in that space. The second pillar is around just better infrastructure. You know, there are programs all around the country. Perhaps we have leaders of some of those programs on the phone today that are doing an amazing job of delivering solutions and food as medicine programs at scale in their communities, really up against bottlenecks and hurdles and implementation challenges that we should remove, that we should facilitate delivering these programs in the easiest, most efficient way possible. And so we provide some direct support to several community-based organizations that are delivering those programs, and also for them to create sort of communities of practice and spaces where we can identify those bottlenecks and then try to work through them. And then lastly, we try to support the design and implementation of better policy. And for us, that means policies that support the integration of nutrition incentives into healthcare. CHLP is one of our partners in that work, as is Tufts. And I think, of course, at this moment in this country, policy is a big conversation. As Robert mentioned, we've seen a lot of flexibility around regulation and policy this year, and we think this is a space where there's a lot of potential to make both short-term and long-term changes. So I just wanted to be brief in this overview, but I would just close by saying from our perspective, we think pushing forward on each of these areas and really giving some oxygen, continuing to give oxygen to these food as medicine programs will not only hopefully scale them with philanthropic support, but really make them something that is appealing to policymakers, to private sector leaders, to other influencers, so that we can take this truly to a national scale and begin to make diet quality one of the areas of focus for healthcare provision for all Americans in this country. Thanks so much.
Good afternoon, everyone. I'm Phillip González, the Senior Program Officer at the Tufts Health Plan Foundation. I want to thank the teams at CHLP and at Community Servings for including the foundation, and on behalf of our foundation board and staff, just welcome all of you to today, and thank you for having this conversation and including us. I'm going to give you a pretty brief overview of the Tufts Health Plan Foundation. I'm really excited about the Q&A portion of today's session, so I definitely want to be able to leave as much time as possible for that. But let me introduce you a little bit, for those of you who may not be familiar with us, of who the Tufts Health Plan Foundation is. So if you can go to the next slide, Katie. So the Tufts Health Plan Foundation was created by Tufts Health Plan, which is a nonprofit insurance company based in Massachusetts, but serving 4 states in New England. You can see the states up on screen. We began in Massachusetts, then moved into Rhode Island, New Hampshire, and now most recently into Connecticut. The foundation's aligned in mission with the company, so we focus on the health and wellness of the diverse communities we serve. But in specific, the foundation is endowed, and our endowment allows us to take a more specific focus on helping communities on their journey to become better places to grow up and grow old. So our focus really is on the grant making side of the foundation, on healthy aging and older adults. And as a regional funder, it makes us the largest foundation that's exclusively focused on older adults and healthy aging. Now, I would be remiss if I didn't talk about the entirety of the foundation. The foundation is comprised of two teams, the grant-making side within which I work, but then there's also the corporate citizenship team at the foundation. And that team is responsible for managing and coordinating the community giving that the company engages in. That includes volunteer efforts, includes sponsorships, other contributions, and board service by employees of the company. Together, the foundation really comprises and reflects the rich legacy and history that the Tufts Health Plan and Foundation have of honoring community and giving back whenever possible. It's part of who we are, and we find this to be incredibly important. Now, the focus on older adults is something that was adopted at the outset of the foundation in our grant making. And we have maintained that focus in recognition of the fact that New England is continuing to grow older, and that for a number of reasons, healthy aging and older adults just haven't gotten the attention that they deserve. Older adults are an asset in our communities. And we want to make sure that communities understand the opportunities that are presented by having older adults in growing numbers in our communities, and the opportunity to have all of us work together to make this a better place for older adults, which in turn makes it a better place for the rest of the community. I'm going to walk through some of the other aspects of the foundation's work pretty quickly, but included the URL for the foundation website. Feel free to go and visit, because we really try to be as open and as transparent as possible, and so encourage folks engaging with us. Now, the grant making and the other work of the foundation, Katie, you can go to the next slide, thank you, are guided by the 4 principles that are on screen. As an opportunity to provide resources and partner in community, we take these principles, these 4 concepts that are up on screen, very much to heart across all of our work. We prioritize collaboration, equity, community engagement, and policy and system change as the opportunity of the foundation. And really, this is realized through partnership and community. We take on many roles. We can be an advocate. We can help communities promote change and create change. We participate in convenings as well as host convenings. But ultimately, what we try to do is honor the community in the lead in everything that we do. And we try to promote that by being inclusive as well. So as I talk about the grant making, understand that this may be the first time you're learning about us, but if you're interested in what we do, we're pretty easy to reach, and we encourage folks to reach out to us because we learn from you and know that the grants are just one layer of the resources that we might be able to offer through our work. So with that, I'm going to turn briefly to the 4 grant making programs that we offer, just to give you a quick taste of the way they're organized and how they kind of reflect the thinking and approach of the foundation. So you'll see right on screen the 4 categories that we offer grants in a traditional year. This year, 2020, obviously was non-traditional for many of us, but in most years, we have organized our grant making according to calendar-based grant opportunities that are available. There's 2 grant programs of the 4 offered in the first half of the year, 2 grant programs offered in the second half of the year. And we typically try and promote these so that folks understand what we do and how we do it, and also to answer questions for anyone that's interested. The 3 dark blue shaded boxes represent our multi-year grant programs. So these are categories in which organizations and efforts can seek funding and support that can last from 1 to 3 years. We think that reflects our goal of being responsive and relevant to community, and also promoting that principle around policy and system level change. We know that it can take significant efforts over time to create meaningful change, and our grant making is structured so that we can reflect that as much as possible. Now, the light blue box in the lower right corner is the Momentum Fund, which is a slightly differently structured grant program, which is designed to support promising efforts, newer collaboratives, and ideas that are just coming into play in community. And so it's a slightly easier process to navigate in terms of the submitting of a proposal. You get a faster response, and as a mini grant program, it's designed to get things supported initially so that we can learn from and learn with folks in community. The grant programs, as I mentioned, are structured over the course of the year. Our website has information about the deadlines and the processes, and as well as contact information for myself and others on the team so that you can ask questions of us if you're interested in looking to partner with us. And so the grants are oftentimes better illustrated through examples, but just to reflect for a moment, the concepts around honoring community and this focus on older adults, really what that means is that we're out in the field, in community, trying to learn as much as possible in real time from those that are doing the work. With a focus on older adults, historically, this year's been a bit of an exception as it's changed a little bit, as we all know, but historically that's meant that we have seen typically 3 to 4 priorities across the geography that we serve. We most consistently hear about housing, we hear about food access, we hear about transportation, and then pretty consistently we also hear about social isolation and civic engagement and the need for older adults to stay connected to community. This year's been a little bit different where the digital divide has risen and in some cases outpaced the needs around transportation. But regardless, what we do is try to learn from what's going on in community, understand what priorities are being set by organizations, residents, and others in community, and then see where we can partner. And the grants that are up here is just a small sampling of grants that we've made in recent years focused on food-related issues. You can see that they range in the number of years. Again, that reflects what is the plan at the community level, as opposed to something that we dictate in terms of how much time we're willing to support. And you'll see that there's an array of efforts and focuses within the grants here. And again, this is just a sampling. It does not reflect, for example, the policy and advocacy support that we have lent to efforts focused on changing SNAP policies in Massachusetts and in other states that have been led through great advocacy and organizations like the Mass Law Reform Institute. But just to quickly touch upon these 3 examples, Growing Places, folks may be familiar with this organization in Central Mass. They're working to correct a market failure where supermarkets are not sustainable in this part of Massachusetts, creating enormous food access barriers for many, including older adults. And we've supported them with a 3-year grant to be able to explore the idea and the concept of a hub and spoke food distribution network that relies on a variety of organizations in an inclusive effort, but importantly, including anchor institutions like a local hospital and a local school district that are able to purchase in bulk and assist with the distribution portion of the model. They're still pursuing this effort, and so we're looking ahead to learning a great deal from what they're able to accomplish and what barriers they encounter along the way. The Open Door is, I know, a very prominent member of this Food as Medicine community, and we're proud to have been able to support their efforts to pilot a Food as Medicine initiative with some of the clients that they serve on Cape Ann and particularly in Gloucester. And then certainly Chilpy, we're also proud to be able to partner in their effort to develop this inventory of programs. We know how important a roadmap of sorts will be to understanding what's developing and what's working in Massachusetts, but also to make it easier for individuals and families, including older adults, to be able to access these resources. So this just gives you a brief flavor for kind of the way we approach our philanthropic work, but more importantly, our community partnerships, and look forward to the further conversation. So thank you.
Good afternoon, everyone. I'm Mike Monopoli from the DentaQuest Partnership for Oral Health Advancement. I'd like to thank you all for allowing me to come to speak to you today about the work that we do, but also the importance of this topic as we move forward. DentaQuest Partnership is a group that is focused on improving the oral health of all. And we're associated with a benefits company that provides Medicaid dental benefits to approximately 30 million people around the country. So that our focus is on oral health and well-being and the ways that we can help to support that going forward. The next slide, please. So what I'd like to talk about today is a bit about our grant making at the DentaQuest Partnership, especially the 2021 strategy that we are developing and will be rolling out over the next few months. But also to talk about nutrition and hunger and oral health. I think of the way that we look at nutrition and supporting people to have adequate food is that the oral cavity is the portal to the digestive system, and it creates the ability for food diversity, for enjoyment of food, and really is a major component of the health and well-being of people. And that COVID-19 has created some especially important issues that we have been also working to focus on so that we can continue to support and promote people's ability to be as healthy and have a quality of life that is as good as possible. And then I just want to talk a little bit about our support for food as medicine, and it's mainly around focusing on social determinants of health and the role that nutrition plays in that. Next slide, please. So first I'll talk about our grant making strategy. So our grant making strategy is focused on a set of values that we have as an organization, and those are around equity, leadership, innovation, and collaboration. That's the core of the way that we think about our strategies and plans moving forward. And the levers that we focus on are partnership to support collaboration, an advocacy approach that strengthens the ability of people to access care, access optimal oral health and ways that we can enhance that as a systems change model. We have been working to really enhance our ability to support analytics and evaluation so that we can create and support and spread data and evidence base that helps our advocate partners to move forward, but also to move forward our strategies around improving health and to be as innovative as possible. So as I said, our initiatives, FPP is a full potential plan, so it's our strategy for 2021, is to continue to support and develop a strategy around addressing social determinants of health and their impact on health, to continue to grow our relationships with partners, with health provider partners, but also a broader and broader range of quote unquote unusual partners as we continue to focus on systems change, to be able to use our role as convener, like the Tufts Foundation. The role of convener is incredibly important as a philanthropy to bring people together and support their ability to share and learn from each other about what they're doing. And again, to incubate innovation and expansion as much as possible. So our strategies are continue to have a partnership with OPEN, which is the Oral Health Progress and Equity Network. It's actually, can you go back one slide? It's a national network that's very diverse and is continuing to focus on oral health and its relationship to health. We will continue to drive federal oral health policy so that we can have regulations and legislation in place that supports improved health, but it always with the thought of strengthening community voice and state-based advocacy and spreading learning models to a broader group of providers, and with a focus on the safety net and a focus on community health centers as the place where multidisciplinary care is most evident and most connected to the community, and also to continue to focus on the issues of COVID and natural disasters and be as nimble as possible in responding to that. And with all of that, we have a set of cross-cutting strategies. Next slide, please. And those cross-cutting strategies is continually to have a lens towards health and racial equity and the ways that we can support our organization to evaluate our internal environment and make sure that we are supporting health and racial equity as much as possible, and continue to interact with our grantees and with the community with that lens. Again, to focus on the social determinants of health, but as a part of value-based care, so a patient-centered care and payment mechanisms that support outcomes rather than procedures, and the role of the community and our partners in driving that structural change and the capacity of the provider community to continue to have a focus on population health. And also, as I said, to build our capacity around data, but data that is not about the community as data, but more about what is the data that is most applicable to community and supports community to be able to be as healthy and strong as possible with learning, capacity building, and innovation. Next slide. So as I said, our focus is around broad ways that social determinants impact health. In 2020, just a couple of examples of the way that we've been shifting our strategy a bit so that we can focus on the unprecedented things that have been happening in 2020. So we donated in Massachusetts $1 million to local relief funds. We donated $2 million to the Massachusetts Dental Society to purchase PPE for providers so that we could help to promote access to care as dental offices reopened when it became safer to do that. And our CEO is one of the founding partners, and we made a contribution to the Racial Equity and Social Justice Fund in Massachusetts. And our portfolio continues to include, and we will grow with engaging multiple community-based organizations that are focused on oral health and social determinants. And we have been supporting Food is Medicine. Next slide. And our support for Food is Medicine has been one of the original funders of the group that is hosting this webinar, first as a co-funder, but then continuing to support development of metrics, and with supplemental funding at the end of 2019 to support development of the Massachusetts plan and white paper. And next slide. So thanks, a quick short overview, thanks.
Well, thank you, Devon, Phillip, Mike, for joining us today. I mean, that was so interesting and informative. We don't have too much time, so I thought I'd jump right into the discussion about food as medicine and the broad range of interventions that recognize and respond to the critical link between nutrition and health. Let me start with you, Devon. You talked about this in your opening comments, but I'm interested in hearing a bit more about this idea of, better evidence, better infrastructure, better policies. What does that look like in the years ahead? Like, what would your hope or vision be for the food as medicine movement?
Sure, thanks, Robert. I think, our hope is that as quickly as possible, we find out if food is medicine approaches are something that can improve diet quality for all Americans, especially those that are low income and suffering or at risk of diet-related disease. And assuming that the answer is yes, those programs can serve that purpose, that we really, frankly, convince policymakers and private sector leaders to integrate them into the way that they do business and make policy. So the reason we feel like we need the three-prong approach is, the way to get better evidence is to have more folks in these programs and have data about their experience and outcomes. The way to do that is to have programs that are built on solid, efficient infrastructure, that can be delivered at a larger scale. And, ultimately, we hope that public dollars will start to support these programs, and that's going to take a policy change. So, as with all things systems change, I think to get to the impact you want, you're sort of operating on all levels at once, and they're quite interconnected. But in my mind, success is, 10 years from now or less, Medicaid and Medicare are covering food as a covered benefit, and folks are being prescribed in a preventative or treatment-oriented way healthy food and getting that through their healthcare provider. And as I mentioned, that the healthcare sector is a proponent of equitable access to healthy food. Healthcare companies are saying we need stronger public benefits when it comes to healthy food. Healthcare companies are saying we need better nutrition education, we need better school lunch programs, et cetera. So we really think moving on all three aspects at once will help us hopefully get to that place faster.
Thank you. That makes a lot of sense. Now, turning to you, Philip, you specifically emphasize the importance of the lives of older adults in terms of what the foundation focuses its efforts on. Can you tell us a bit more about how you came to recognize the importance of food as medicine as a funding priority? And then also what you see in terms of the future. What do you hope to accomplish through yours and others' investments in this food as medicine movement in terms of the lives and health of older Americans?
Thank you for the question. It's pretty compact. Happy to take it on. So yes, with the focus on older adults and supporting things like the healthy aging data reports that the University of Massachusetts Boston Gerontology Institutes put forth, we know that, for example, older adults 65 plus, the majority of them live with 4 or more chronic conditions. And we know that medicine alone isn't the driver for health, and food is an important equation, and not just the ability to secure food, but also to have the food that's going to optimally provide for your health. So we think that there's this complex kind of interweaving of issues that food as medicine is pretty squarely in the middle of. The need for folks to recognize that food is not something that people should take for granted. It's not universally accessible, and the ability to get what you need to support your health and your optimal kind of living situation is something that should be supported not just by the food distribution infrastructure, but also by the healthcare sector and the others that are looking at overall wellness. So for us, I think it's very much an intersectionality contributor in terms of food as medicine, alongside food issues that we hear about on a regular basis. And from our perspective, I think our strategy is probably complementary to what you're hearing from my colleagues on the panel. We want to make sure that voices are at the table, that the experiences of individuals and organizations and community are alongside this great data and evidence and kind of return on investment calculations that help drive the conversation. We need communities to ask for this. We need communities to appreciate the value of it. And we need folks to understand that getting food out, like we've seen a massive undertaking develop under COVID, is wonderful, but it's not necessarily what will kind of, at the end of the day, result in the systems that we ought to have.
Thank you. One question we just received is, can you tell us a little bit about, what age group you're talking about when you're talking about older adults? And then do you focus on specific either economic or health conditions? Like, do you have a particular focus in terms of your work?
So great questions. We don't stipulate an age. We don't have a cutoff. The data that's in the Healthy Aging Data Report is taken from data sources that begin with 60 and 65 plus. We've seen proposals from folks working with folks in the 50-year-old range. So it's really up to the community to define what's the population they're talking about. Sorry, can you remind me of the second question?
The second part of the question, sorry, is do you target any particular income group or any specific health conditions that you see as really a focus of your efforts?
So we really take our lead from community, and so we love to hear what community's thinking about and what priorities it's developed for themselves. I will say that our interest and guiding principle on equity means that we are very much interested and focused on communities of color, people living with lower income, immigrants, others with that have experienced disparities and systemic inequities. But in terms of, but beyond that, I think it's, if you look at the grants that we've made, you'll see a pretty wide variety of issues and kind of segments of the population represented, from rural communities in northern New Hampshire all the way to the kind of core cities in Rhode Island and everything in between.
Thank you. Mike, turning to you for a second. I mean, the DentaQuest partnership has really been a leader in efforts to transform the practice of dentistry in many ways, or at least our understanding of it. In the food as medicine context, I mean, it's been for years, you have really been highlighting the critical connection between social determinants of health, such as nutrition, oral health, and overall health. Can you talk about the role ultimately that you want to see the dental community itself play in addressing food and nutrition, food as medicine kinds of issues?
I think, yeah, we have, as you said, been focused for a long time on specifically oral health and the ways that oral health impacts health, and the way that poor oral health has systemic complications around diseases like diabetes, but also the way that systemic disease impacts oral health. So I think that part of our focus has been on dentistry, which is the the treatment of teeth and supporting structures, but more on oral health as a component of the overall healthcare environment. So we have been working to engage our provider community to be advocates for health, to be able to make the case of the importance of the oral cavity for a diverse nutrition, but also to go beyond that and to advocate for their community and the areas where they work. As I said, we're national, so we have multiple millions of covered lives that we work to continue to support an environment where all of those, mostly children, but a lot of adults as well, have access to important nutrition and diverse nutrition that is beneficial calories.
This can be for anyone, but it is a follow-up in some ways to what you were talking about, Mike. So there's no question that in so many contexts, one's oral health or decline in oral health can really be an early manifestation of something going wrong. It's just an incredible diagnostic tool around health. So it gets to sort of the root. You start to see really early on something going wrong. It just made me think about, like, to what degrees do any of you try to focus on, so what are the root causes of this food insecurity in our country? Like, how do we try to address that? And do you think it is tied to the work that we're trying to accomplish in the food as medicine movement? I would open that to anyone.
That's always hard when it's a panel, because we all look at each other who wants to go first. But I think it follows our focus has been on systems change. I think with oral health, the disparities and the access issues are more profound probably than the rest of healthcare access, and that the most important things that we can focus on are what are the outcomes of that lack of access and those disparities, and it's all about root cause. It's all about going upstream to see what are the causes of these problems, rather than to try to address them as they happen and avoid them. So we've been talking about a more preventive focus in ways that we can avoid. Our mantra is no more drills, which I think is something that would be popular across the community and the world, and that we can actually manage dental disease in a different way, especially in children.
Yeah, very related question, Devon. The foundation has been a leading effort at this idea of resetting the table, if you will, to really transform the US healthcare system. And certainly the COVID pandemic has really shown a light on so many of the inequities that have always existed, and really just exacerbated those inequities. Can you talk a little bit about, so what are the real key policy priorities in particular that you think will try to help to address some of these root causes of food insecurity?
Yeah, I think I would just say from a Rockefeller perspective, I think it's a yes and answer. So we work on the immediate, lack of access to healthy food for an increasing and really stunning amount of Americans this year, and also on the root causes. And some of that comes through our food portfolio, but a lot of it comes through some of the other portfolios we have at the foundation, including our equity and economic opportunity portfolio, which explicitly focuses on some anti-poverty policies, including the earned income tax credit, which we think is one of the key sort of anti-poverty measures that we have here in the US. I would say from a food system perspective, I think it might even have been built into the question. I mean, some of the policies are around food and farm workers and living wages of food and farm workers are generally utilizing SNAP at double the rate of the general population. And that's a little mind-blowing when you think about the folks that are delivering us our food and aren't able to afford it themselves. So I think there's some policy on the food and farm worker side. I think in the paper you referenced, Robert, we also talk about policy related to public benefit programs like SNAP and WIC, to regional food systems and building more local economic development engines and sort of resiliency engines in the food system at a regional level. And then as we've been talking about today, the healthcare policy piece and being able to just leverage healthcare dollars, which as this group knows, are incredibly high. I think $1 in every $5 of federal spending goes to healthcare. So leverage those dollars to deliver health through food, I think is a key change. And I'll just end by saying this is a really, unique is not the right word, but we're in a moment here, as I think we're all recognizing. And I think it's really up to us not to lose the momentum and attention and sort of keep some of the doors open that have opened this year from a policy conversation standpoint and make sure, I think what Phillip's saying about having the community and the right voices at the table is incredibly important as a part of that conversation. So making sure to integrate that into the policy conversations that are happening as cabinet members are being named and policies are being drafted right now, in Zoom rooms all over the country. So I do think it's a unique moment, and I think we have a lot of great tools, and it's a matter of making sure that those tools get used and are felt to be important by those that are making decisions in the coming year.
Well, I just want to thank you for your leadership on this idea of, an integrated nutrition security system, and really just putting forth the idea that healthcare and access to healthy food is a right. So very much appreciated. So Phillip, just turning to you, can you talk a little bit about the impact that COVID is having, particularly on older adults, and the ways in which this is really highlighting the focus of your efforts? The direction that the foundation needs to go in terms of responding to this issue?
Sure, happy to. And I think it echoes some of what's been said, because I want to kind of say ditto to some of what Devon was saying. Older adults have absolutely been spotlighted in this pandemic. We know how directly it's affected older adults in terms of putting their lives in jeopardy, and upending the systems like long-term care and nursing home facilities that we've often just kind of thought of as someplace we might all end up in. But it's just done the same with food access. And, I think that moment that Devon's talking about is something that we really should reckon with. I think the much more in-depth and nuanced coverage around the food dilemmas that are, part of our system is something that I think we would have fought dearly to try and get some attention to in past years. And this year, the media is trying to figure out, what does it mean that a senior center may be the place where you rely on for your lunch every day, or the schools are the place where the students are getting their most regular food supply. How do we think about that? For us at the Tufts Health Plan Foundation, it's meant, pivoting quickly, like many of us did, to put funds out on the street so that community food banks, which we supported across the 4 states that we serve, are able to do the immediate response. And it wasn't just about older adults. And then since then, we've continued to support, and consistently talking to folks over the last 10 months, food access has been the top priority at the community level. And it's just spotlighted, as you mentioned in the opening comments, the fact that our system isn't necessarily a system. These different programs, whether it's senior center meals, whether it's Meals on Wheels, whether it's school-based lunches, whether it's SNAP, run by different agencies, structured to provide different services and target different populations. And so I think we have an opportunity. Maybe the silver lining in all of this is that there's a point where we can say, we've done some things, we've added some flexibility to SNAP this year. Can we keep things like that? Can we see how that should better interconnect with the other programs and build from there with data, with stories, and with everyone that ought to be at the table, finally understanding how important this issue is.
Thank you. I want to try to end last question on a sort of optimistic note, I guess. We're going to go have a new president in the White House and a new Biden-Harris administration. Can you talk a little bit about, are you optimistic? Are there ways in which you think the new administration will help to promote food as medicine goals, health equity, food equity in ways that can really help us to move forward in the coming years? Anyone have any thoughts as to what that might look like? Mike, you're on mute. We have to say that at least once per webinar.
It has to happen in each webinar or else. I think with any new administration, there's opportunity to have a different movement going forward. I think the opportunity right now is engaging the transition and the new administration around this issue. I think I'm hopeful that it will be a listening ear and that we will have the possibility of moving this forward so that we can help to promote equity. And I think that will be a topic that this administration will be interested in talking about.
Yeah. And I think it's true, like we've made progress in the Medicare program over the past few years in terms of their recognition of social determinants of health. And I'm really hoping that that was just the beginning and that the incoming administration will even build on that.
Yeah, I want to echo the optimism. I think I don't know when we get to catch our breath, but I think when we do, it's a moment that we need to really kind of take advantage of to reflect on this. You know, we haven't talked about the social side of food and what it means to have a meal with other people, and to know that the process of purchasing, preparing, and consuming food is our social activities, and those are important things that we are looking forward to getting back to, and that's something that I'm also optimistic about.
Yeah, I would share maybe 2 points. One is I personally think part of the power of food as medicine and some of the programs we're talking about is the intentional partnership and coming together of partners that haven't historically come together to provide some of these services. And so my hope is that this administration will be more open to partnership of lots of different kinds, and that a piece of that will be working more effectively across agencies and parts of the government to help some of these programs to grow and expand. And then my other hope is just that and you know, I have optimism that this is the case, that this administration will recognize the incredible achievements of folks that have been working in communities and on the ground this year, and the way that in a time of crisis, they really flew past a lot of things that we used to say were impossible, programs that could never scale in the course of a month, or, you know, policy implementations that we said would never happen and suddenly happened. And so I'm really optimistic that this administration is going to celebrate those successes and then figure out, to Philip's point, a way to keep some of those improvements going over the long term.
It's a great point. We didn't really get to talk about the implications of so many of those really positive changes. I just want to thank you so much for joining us today. I'm going to turn it over to Katie now to close this out. Thank you.
Thank you, Robert. And thank you to all three of our amazing panelists today. I think as David and Robert really set up at the outset of this webinar, as we've heard sort of repeated throughout, you know, we are in a challenging moment as a country, but we're also in a very powerful moment. And so I love that we're ending on that note. And I think that's something that sort of echoed across all three of our webinars for this 8th annual Food as Medicine Symposium. And so I like that idea of ending on an optimistic note. Let's see where 2021 takes us. So thank you all for rounding out our webinar series. And I also want to end by, of course, noting that all three of these webinars are recorded and are available on our website on www.chilpi.org. This one will be added within the next week. There will also be information about Food as Medicine, our Food as Medicine efforts, these sessions as well on foodasmedicinema.org. So we invite individuals who've attended here to join us there for more information, to hear what's happening here in the state, what's continuing to happen across the country, and where we go next, which is where I think we landed. You know, I think it'll be, it's an exciting moment, and I think we're gonna hopefully see some real progress in the coming year and into the future here. So please join us there for more information, and look out for recordings of these sessions. And finally, again, thank you to all of our amazing panelists.
Thank you.
Thank you to Robert for your wonderful moderation, and thank you to David for your opening remarks. And thank you to all attendees who've joined us today and at all of these sessions. And we hope that you have a wonderful holiday season. Thank you again.
Thanks, everybody.
Thanks, everybody.